Welcome everyone. Today we are excited to bring you an enlightening discussion that bridges two incredible platforms, Med Talks by Dr. Anita and Expert Medical Insights by Dr. Mohan. Well, we are here on a mission together. I'll break this suspense in few seconds. I am Dr. Anita and I'm honored to be joined by the exceptional Dr. Mohan Rangaswamy, a trailblazer in the world of plastic surgery with over 35 years of unparalleled experience. Known for his precision and dedication to patient care, Dr. Mohan has profoundly shaped the field by pioneering advancements in aesthetics, reconstructive, and regenerative procedures. His work has cemented his reputation as one of the most respected experts in plastic surgery in the region. This collaboration between Med Talks by Dr. Anita and Expert Medical Insights by Dr. Mohan stems from a shared mission to bring forward the undiscovered and lesser known aspects of medicine and make them accessible to everyone. At Med Talks by Dr. Anita, the focus is to empower individuals by raising awareness about medical advancements, enabling them to make informed decisions for better health outcomes. Joining forces with Expert Medical Insights by Dr. Mohan Rangaswamy, a platform dedicated to showcasing the depth and breadth of plastic surgery. Together, we are working to educate, inform, and inspire through expert-driven conversations. Let's begin this insightful journey and gain valuable perspectives from the expertise of Dr. Mohan Rangaswamy. I'm so excited again to have you, Dr. Mohan.
And wonderful to be on this journey together.
Yes.
Every podcast, we aim to inform our public, our audience,
Yes.
on aspects which are common as well as those that are uncommon, to raise the awareness, as you rightly put it.
Yes, we are on a mission.
It's my mission to bring the knowledge in a simple way so that it's easily understandable.
Exactly.
And we are more than happy to answer any questions. You can put them down in the comment section.
Absolutely.
Whatever questions you have.
Absolutely. Because plastic surgery, more of people, they understand it's more of Botox and fillers, but it's way beyond that. And I think we need to let people know that it's way beyond just Botox and fillers, right?
It's a field which garners immense interest among the public, more than many other fields. But that also goes parallel with a lot of ignorance.
Exactly.
Which can be expected.
Absolutely.
And much of it is also because of skewed exposure that is given in the media.
Oh.
And so here we are to correct those
Explore,
misconceptions
right.
and put the truth across.
Exactly. So today our topic is breast implants.
Sure.
I'm a bit excited.
Sure.
Like, how was it invented? What is breast implants? I mean,
so
if
breast
you can just
implants.
Walk us through the history.
Breast implants are medical devices, first of all, and they are usually made of silicone envelope, and which is filled inside with usually silicone gel.
Is that the only one type, or
there are
different
types? There are also implants which are filled with saline water.
Okay.
Currently, only these two are allowed. There are many that came and went. So we needn't talk about them because they were totally rejected outright after a few years of introduction.
Okay.
So currently, it's mainly silicone gel. And for those that are interested in using the saline implant, that's also available.
Nice. What is the purpose of breast implants?
So if we go back in history, around 1960-61, let's say,
Okay.
at that time, breast implants had not yet been invented. Of course, they had breast cancer and they had women who needed a reconstruction, who were looking towards reconstruction. And more so, the surgeons wanted to help these women who are disfigured following the mastectomy. And those days, the mastectomy used to be much more extensive.
Aggressive, right?
Yes.
Ah.
So what happened was, this is an interesting story which was told to me by Dr. Thomas Biggs, himself a resident at that time. And as he was going to fetch a bottle of blood for his patient, the blood bank gave him a bag of blood instead of a bottle of blood.
You mean to say this is how the invention happened?
This is the story.
Okay.
This is a real story.
And you have you heard from him himself?
From the horse's mouth.
Oh, that's nice. Okay.
So the blood bank told him, from today we are discontinuing bottled blood, and blood will now be given in bags.
Okay.
So he carries this bag, tossing it between his hands, and young man. So he thinks so he thinks this feels like a woman's breast. So he goes there and hangs the blood, and the patient is getting blood, and the ward rounds start, and the consultants, they come and they said, what is this? Because the consultants also haven't seen this bag of blood.
Right.
So the resident explained that this is like this, like this. So immediately the consultant called the blood bank and found out who is the supplier who makes these bags. And he had a chat with the supplier that, if these bags are good enough to keep blood in, that means it is tissue compatible. It will not harm the tissues.
It can stay in the body.
It can stay in the body.
Right.
So, they had a discussion, and the breast implant was made by Dow Corning which was the first company that made these implants. And those implants were made with silicone envelope, and then they had some stickers on the back of it to help it to stick to the body.
Oh, stickers.
Yeah, like Velcro stickers, you can call them. Dacron patches, actually, they were.
Okay.
Okay. So these were first tried in dogs, female dogs, let's say, put behind the breast of the dog.
Okay.
So that
Went well.
Went well, and that dog must have been the star, let's say, much sought after, I suppose.
Right.
But jokes apart, then it started getting implanted in people for breast reconstruction.
That's wonderful.
Soon there were problems. There were like hard capsules forming. Some cases went well. Some cases the tissue was very hard because the capsule was forming. So there were steady improvements done to the implant. They took away these Dacron patches. They improved the silicone. They improved all that. And then that's how the first generation of breast implants came. They were smooth.
1961 this happened.
Yeah, 61, 62, I think the first implant was done. Initially for reconstructive purposes and later on for augmentation purposes. And then since then, there have been about 5 or 6 iterations of breast implants, let's say, or improvements. So currently we are probably in the 6th generation of implants.
That's nice. What you mentioned augmentation. What exactly is augmentation?
So augmentation, as the word suggests, is improvement in the size. So put it very simply, enlarging the size of the breast by using a silicone implant behind the breast.
Is that only the implant, or there are other ways also to do the augmentation?
Today we are also able to do it with fat grafting, but for a long time, and even until now, the gold standard is a breast implant. But fat grafting is increasingly also being used.
So how does it
work? The two
work?
can be used together.
I mean, how does it work? In which cases people should go only for the implant, or when they should look for fat grafting as well with the implant?
Well, let's start with the implants. The implants being the gold standard for breast augmentation is whenever a person, let's say she is interested in enlarging the breast size. This may be her personal wish. Maybe she is really, small compared to the average, whatever is considered the average, or among her peers, personal desire, for example, or she loses volume following, let's say, severe weight loss, sometimes following illness, sometimes following pregnancies. Paradoxically, there is a fall in volume in some women, not in everybody.
Right.
Okay, so these could be many reasons that women go for breast augmentation. And now that it is available, now that it is well known, now that it is considered safe, more and more women seek it out. In fact, it is probably the second most commonest cosmetic procedure following after liposuction.
Okay.
So breast augmentation is done usually with the silicone implant, as I told you. They come in different sizes. They come in different shapes, like a round shape or anatomical shape. We will discuss more about it.
We will discuss about it.
I brought some implants and I will.
Oh, you got it with you.
Yes,
I'm glad.
yes,
Thank you so much.
Okay.
Thank you.
Yeah, because
we'll talk about it,
it's
exactly.
better to show. And,
absolutely. Absolutely.
Exactly.
Right.
Yeah.
Okay, so augmentation we were on. So augmentation can be with implants as well as with fat grafting.
But nowadays
or
we can also do with fat grafting, and we can combine the two together. So the distinction or the difference between the two of them is that breast implant gives you exactly the volume that you are putting in. Okay.
Right.
So it's predetermined volume of breast implant that you choose, and for sure you're going to get that volume.
Get that volume.
Right. Okay. There is no ifs or buts about it.
Right.
And also the jump in size is impressive and significant. So called the wow effect.
Right.
So anybody who's looking for a significant improvement in size should prefer an implant.
Okay.
But there are some people who don't want to have a foreign body in their self for whatever reason.
Right.
And they are looking for options, more natural options,
right.
more organic options, if you like. So there we can use fat grafting. So the fat grafting will give 1/2 to 1 cup size increase in the breast volume, and more importantly, it is giving better fullness in the cleavage, better fullness in the upper part, and a little bit of fullness all around.
Fat grafting.
Okay. But fat grafting feels soft and it is natural.
Right.
Okay. But you cannot do big augmentations with fat alone, at least not in one session.
So fat grafting is removing the fat from the unwanted
from one
areas?
part of the body and grafting it by injection using blunt cannula. So the advantage of fat grafting is that there are no scars, there is no open surgery in the breast, and faster recovery. But the improvement is conservative. Right. And also an implant gives you more projection. If somebody wants a good projection in the side view profile, that can only be achieved by an implant. Fat cannot give you the push. Fat can give you a soft enhancement all around. Something similar to, let's say, if somebody gained 5 or 10 kilos weight, she's a little bit bigger, something along those lines.
Right.
But the two combined together bring two different worlds together, and that is probably the best.
A combination. Big combination.
Yeah.
Nice.
Composite augmentation, because the implant is there to give the push and the projection, and fat grafting is there to give the circular enlargement, the cleavage, the upper pole, etc., and more natural feel and softness. So if we are going to use composite augmentation, we can choose a smaller implant.
Okay.
And in a breast, if less than 50% of the total volume consists of an implant, it feels and looks like a breast.
Natural.
If out of the total volume of the breast, implant is more than 50%, it will tend to look more and more like an implant. Putting it roughly.
Right. So always the combination is the best thing to have.
Combination is the best, but combination also increases the cost a little bit because it takes longer. It takes as long to collect the fat and do a proper fat grafting as it takes to put in an implant.
Right.
So it's almost double the time.
Right. But worth the effort, right?
But worth it.
Worth the effort. I mean, whatever is...
And it can be, the best part is it can be done together, or it can be done sequentially. For example, let's say somebody gets an implant done, and she decides after 6 months, okay, let me have some fat graft for boosting particular areas.
Okay.
So fat can be tailored to particular areas, inner side, outer side, upper part, lower part,
the way you
etc.
want to curve it.
Whereas implant is one object.
Right.
That one object sits in the center of the breast. Yeah.
So shaping up can be done by the fat grafting.
Shaping,
and that's always
yes.
Shaping up,
Let's say fine tuning.
Defining.
Let's say fine tuning.
Right. So Dr. Mohan, what is the process of getting a breast implant done? Like how it starts and what it finishes at, how a person should decide which implant they should go for?
So very good question. The whole process starts with a consultation, and that I think is the single most important thing, even more important than the act of doing the surgery.
I absolutely agree.
Because it's a process that I go through with the patient, because very often when the patient comes, she's not very sure what size she wants. She is thinking bra cup sizes. I am thinking volumes.
Right.
So we come from two different, let's say Venus and Mars.
Right.
So for her to understand how we function and what a volume means, what 250cc looks like, what 300cc looks like. So we have a whole lot of sizes available in my clinic. So we let them see those sizes, handle them, and also feel the weight, because she's going to carry this weight.
Right.
So let this sink into her mind. Okay, 300cc implant looks this big. She puts it on herself and tries it out. So what we do is we tell the patient to bring an unpadded bra, bring a tight t-shirt or a tank top, and we have a big mirror, and then we pop in different implants inside the bra. Okay. She wears the bra and we pop in different sizes implants, and she looks at herself after wearing the t-shirt. This is one way to see which size suits.
We should go for, right.
Secondly, I take measurements of the chest, not the breast, the chest, the bony measurements, because the chest has to have a certain measurement, and for each measurement, this is the maximum implant that this chest can take.
Is it? Why so?
For example, if somebody is narrow chested, you can't put a big broad implant, because the implant can only exist from here to here.
Right.
If you put a broader implant,
based on the width of the
base width of the implant must match the base width of the chest, available width.
Right.
Otherwise, the excess is going to go here. Or you have to fold the implant and squeeze it in. And when
I'm sure people don't know about this. That's the reason of over expectations.
Exactly. People come saying that I want a 500cc implant. Have you felt a 500cc, how heavy it is? Do you know what the diameter is? So these are the problems. So what we do is we start with her measurements, and we have these implant charts. And we say, okay, you have 11 centimeters of available width. And I sort of open the chart and say, let's look together at 11 centimeter, what are the options available? Right. It'll narrow down to only 4 or 5 options. You say, okay, these are the sizes that you can choose from.
Right.
Now it depends whether you want more projection or less projection.
Right.
If she says, I want more projection, we go for a higher volume for the same width.
Okay.
And in order to know whether she wants a high projection or a moderate projection, again, she may not be very clear. She may not have thought through all these things. So we make some drawings and say, would you like in your side profile, would you like people to notice your forward projection, or would you not like people to notice?
There's so many things at the back end, no? People just feel like, okay, just go and see the size and then
some people say, no, I don't want to be so noticeable like in your face, but I would love to have more cleavage.
Right.
Then we go for a medium profile or a medium plus profile. So the profile has to be decided, the volume has to be decided, the matching between the chest dimension and the volume has to be decided. Then it comes to whether you go for a round implant or a teardrop shaped implant. That depends whether they would like to have a fullness in the upper part or they don't want to have a fullness in the upper part. Those that don't want to have a fullness in the upper part tend to go for teardrop.
Okay.
So once all these variables are put on the table, it narrows down to 3 or 4 implants.
Do we have the teardrop implants? You got it with you? Oh, wonderful. We'll be talking about it.
Yes.
Great.
So this is the process. And then we discuss about how the procedure is done and how the post-op course is going to be. So as you can imagine, all this cannot be covered in one consultation. So normally this will require 2 consultations. So the first consultation is preliminary, examining her and maybe ordering a few tests like basic ultrasound, etc. to check the breast is okay. And then we tell them, bring the bra, bring the t-shirt, come with enough time on your hands.
Absolutely.
And we will do the sizing. So that's called a sizing appointment.
So consultation plays a very important
2
role.
consultations. So the second consultation is the sizing
consultation. Can we offer a complimentary consultation for our listeners?
Of course we can.
Wonderful. So let them have an advantage of a complimentary evaluation. Perfect.
Definitely,
Great.
definitely.
Thank
They just have to say that they saw us.
Yes. So
on this.
Audience, make sure you can drop in the comment if you want to come across having a consultation with Dr. Mohan. Yes, you are lucky to have it. Yes.
Okay, so that's the consultation part, and after that the surgery is booked and the anesthetist will do the basic blood tests, etc., evaluate them for anesthesia. Usually this is done under general anesthesia. It takes about hour and a half to do.
Okay.
It's a day procedure. Same day they can go home, and they have to wear a support bra for 3 weeks after that. The incision is usually under breast.
Okay.
And the incision is small, about 4.5 to 5 centimeters in length. Usually it merges very well with the fold. So the scar or the incision, usually people worry a lot about it, but it's nothing much to be worried about, because the way I suture it, it's very, very fine, extremely fine. If you take good post-operative care, it ends up with a very, very fine.
I have seen that precision of yours to take suture in the OT. I was lucky to be with you in the OT.
Thank you.
Yes, it is great.
So that is the process. And we always use, at least I always use local anesthetic injection even before I start the breast surgery and even at the end. So patients wake up not feeling any pain.
That's great.
So they go home, there is no pain. Next day they will have a little pain, easily controlled with tablets. The pain may be for the first 3 days or so, and after that the pain also goes away. Yeah.
How long people can have the, women can have the implant in place, and when they should think of changing it?
Well, okay, this is a very important question, because there's a lot of misconception that goes around, and also some of the companies and maybe, sorry to say, some of the doctors also tell patients that implants are forever, and implants are not forever. So studies have shown, especially with the 3rd generation of implants, and now of course we have even better implants, but let's just take those available statistics to say that beyond the 8th year of implantation, the leakage rate starts increasing. So generally I recommend change of implant after 10 years. Okay. Now
whatever implant it is.
Yes, most of them. Now there are some very new implants where the company is again saying that you don't have to change it, but I don't buy that. I would tell the patients that, okay, since they say that it's going to be almost permanent, I would say I would move the 10 year to 15 years until we have more evidence. But what's important is that you should check the implant every year. Let's say 3 years after the implantation, 3 years later, one ultrasound check can be done. Then ultrasound can be repeated every 2 years. If the ultrasound picks up any abnormality, then an MRI scan is ordered. In general, in the first 10 years, almost, let's say 90% of implants, 95% of implants stay good. The leak rate is small, but beyond that time, the leak rate does increase. So it's better to change. Also, remember that after a decade, when you change, you're getting the next latest implant.
The latest one.
And the implants are always improving.
Yeah.
The companies are all, manufacturers always improving, like the next model
Which is
of
the
the
best
car.
one?
I'm not taking any brand names.
Yes, please do not do that.
Let's say there are 4 or 5 brands in the world. 2 of them are American. There are a couple European ones. And these are well known in the plastic surgical field. They're almost all equivalent. They follow good standard practices.
Is there any way
they have
to
a long
choose-
history as well. Yes.
Is there any way to choose between good implant and the one which is not a good to go?
Well, the point here is those implants which were not good have gone out of market.
I agree.
So currently the implants that are being sold in the market are all certified. They've all had their testing cycles and experience of more than a decade at least. They've been in the market. So in UAE, the brands that are available are all very well certified. They go through the Ministry of Health for approvals.
Agree.
So currently the brands that are available here are all good.
But then I remember you mentioning once that there is an implant recently which is lighter. So there is a new advancement and a better one, right?
That I would call almost the 7th generation.
Okay. And what are the benefits of that implant?
That is a lightweight implant. It's called B-Light, and it's 30% lighter, and it is filled with the silicone gel plus small microspheres. So these spheres are almost weightless, let's say. And the company says this is borrowed from NASA technology.
Okay.
So this composite filling material in the implant makes the implant lighter, 30% lighter.
Okay.
Therefore, the woman feels lighter.
That's
or if she chooses a slightly bigger implant also, it's not that
it's
heavy.
It's light.
See, the point in terms of the size, we discussed how the sizing is done.
Right.
Now, I generally encourage patients not to go for very big sizes. Okay. But some of them have fixed ideas in their head and they want to be big. Okay. In that case, after explaining, we have to yield to the patient's request as long as it is within reasonable limits. If somebody is asking for 600cc implant, 800cc implant, I'm not going to do that. But within the range, see, if you go for a heavier or bigger implant, which necessarily is heavier, there's more likelihood of sagging. Right? Especially if the woman already has a slight sag. See, it depends on the tissue integrity or how strong the tissue is. You know, when we examine a person's skin, for example, just the skin quality and the quality of the tissues. Some of them you can see that the tissues are very firm. This is not going to sag easily. Others is already sagging. Those that are already sagging is mainly due to genetic reasons or due to weight fluctuations or racial. For example, people from the Far East, they have very tight skin. They don't sag easily. They have smaller breast in general, but their skin is also tighter.
Firm. Right.
Yes. So, for an example, you know, I'm giving the importance of racial features.
Right.
So, racial features, individual genetic issues, weight fluctuations, those that have had weight swings, and whether there are stretch marks on the breast skin. If any woman looks down and she sees stretch marks on her breast, she already should know that the skin elasticity is lost. Right? And sometimes these stretch marks appear just in puberty. She's not had a child.
Agree.
She's maybe only 18 years old.
Agree.
But she already has stretch marks. Due to the interplay between hormones and the collagen.
Agree.
See, the collagen that is there in our body, which is the binding block for all the things, the collagen has different types of collagen, type 1, type 2, type 3 and all that. The proportion varies among different people. And the strength of the collagen and elastic fibers also varies. So these factors become very important. Each individual person has to be individualized in the choice of implant. So I use what is called a body logic system. There are different systems to use, how you choose an implant. So I'm again coming back to the same. The choice of the implant, considerable amount of time is spent on choosing the implant that, in my opinion, is the best for that particular person. Of course, we involve her in the discussion. And if she is not convinced and if she chooses a different size, we discuss that. And if that size that she chooses is way off the mark, we need to discuss more.
Agree.
If it is within reasonable limits, we go ahead.
Got it. Dr. Mohan, is there any complication or risk with getting breast implants done, or maybe there is some illness that happens because of getting these implants?
Okay, your question has two parts. One is, what are the complications that could happen in a breast implant surgery? And the second part is that is there any illness associated with having a breast implant in the body? Okay, let me clarify both of them. So in terms of complications, if you take any surgery, some complications are possible in any surgery.
Agree.
For example, infection can happen, wound healing problems can happen, serum collections, bleeding post-operatively can happen. So, in common with other surgeries, these are possibilities.
Even loss of nerve sensation, right?
Yes, that is more specific to the breast implant. I'm coming to that. So, these complications can happen. However, we take so much precautions, at least in my series, these complications have almost been non-existent. In the entire career, I can remember only 2 people who had a bleeding, and one of them had taken aspirin and not told us.
Wow.
So, of course, before surgery,
the level of precision,
one
only
should
2 complications still now,
only
almost
2
more than 35
complications
years.
of bleeding, no seromas, no infections, no wound opening up, and in terms of sensation. Now, very important point, because the nipple sensation, the nipple gets its nerve supply from multiple sources. But an important source comes from the outer aspect, from the 4th rib area. Now, when we do the pocket, making the pocket for the breast implant, we actually go to that area and start becoming very cautious. I tell myself, okay, the nerve is somewhere around here.
Right.
Sometimes you can see the nerve, sometimes you cannot. But you know that the nerve is generally around here. There are individual variations. So in that area, one is very, very careful. Now, if you take adequate care, and I always check my patients after surgery, how is your nipple sensation? And they usually say, yes, it's okay. But if I have to put in a big implant, what happens? I have to make a wider space.
Right.
So I will be impinging on the nerve.
Right.
I may even have to cut the nerve or stretch the nerve so much. Now, if I cut the nerve, the nipple sensation will decrease. If I stretch out the nerve in order to accommodate the implant, then the nerve is getting stretched over the implant, and that can give pain in the nipple for several weeks. So this is one of the reasons I tell my patients that please do not choose very big implants. Otherwise, we have to fold the implant into this small space, and an implant that gets a little bit of a folding gets what is called a fold flaw fracture. That means any item that you fold it, plastic items,
Right.
along the fold a crack can develop
Crack
more
can
easily,
develop
isn't it?
easily, right,
It's common,
right.
common to see.
Agree.
So we don't want an implant to have folds. So if you push an implant which is 12 centimeter wide into a breast which has only 10 centimeter space,
Right.
you obviously the implant will get folded.
Agree.
So you have to understand that I have a max implant and I should not go beyond this size. If you want to go bigger, yes, you can use fat grafting later on. That's where the fat grafting comes in additionally.
Right.
So since I'm careful about the nerve and since I sort of do not entertain patients who want very big implants, I don't have a problem of nipple sensation loss. All right?
That's nice.
Okay. Then the illness part. Now it's a very vague subject.
Before we go to illness,
Yes.
till now, more than 35 years of experience, you have got only 2 complications.
2 complications of bleed.
And that too,
which
one was aspirin, patient
aspirin
didn't tell you.
based, and the other we don't know why, but that was a patient from the Far East.
Only 2 complications.
Only two.
The master.
Thank God.
Yes. Coming to the illness, touch wood, yes. The
Okay.
illness part.
Okay, so the illness is there is something which is vaguely referred to as a breast implant associated illness, or BII, breast implant illness. Now this is vague symptoms. People describe it as not having enough energy level, brain fog, joints aches and pains, not feeling in the best of health, things like these are all very vague symptoms.
Okay.
And those women say we have tried everything, we've got all our checkups are normal, and I think this is because of the breast implant. So it's a kind of a self-diagnosis. Is there truth in it? It's still people have investigated, no concrete answers have come out. However, here's the thing. Let's say a woman got breast implant around the age of 30
Right.
or 35, and fast forward she's around 50. Now in that age, many people get many problems, especially women. Especially women, I say, because there is a higher percentage of connective tissue disorders, rheumatism, rheumatoid arthritis, etc. in women more than in men. So on that basis, they get some arthritis, let's say, and they have an implant in. So they try to put 2 and 2 together, and they say this could be, but there could be, I'm not outright rejecting it, there could be a small minority of people where the presence of a foreign body in a reactive immune system can produce certain chronic ill health kind of a.
The body is taking its own time to adjust
So
with that
these
sometimes.
people, some of them, they say after the implant comes out, they say their health improved.
Okay.
So retrospectively, possibly there was some truth in that. But there's also the placebo effect, which you very well know.
Yeah.
So the truth is not yet out. It's still we don't know.
Okay.
But yes, if somebody has a lot of connective tissue problems, rheumatism and all these kind of things, probably she should not go for a breast implant.
So, Dr. Mohan, these illnesses, whenever people have or they get some illnesses, or whenever they have an illness, they have to be careful to get an implant done. So, I think they should have a proper consultation from their doctor and understand the do's and don'ts of it, right? They can still go for the implant.
See, I'm talking about a very small group of people who have these rheumatism kind of diseases, connective tissue disorders as they're called.
Right.
For example, systemic lupus. It's a serious disease, SLE.
Right.
So somebody with SLE wants to have a breast implant, I would discuss it with her rheumatism doctor.
Okay.
Yeah. So the specialist dealing with rheumatic conditions,
Right.
rheumatologist,
Right.
and say, look here, doctor, your patient wants to do this. Do you think it is okay? Because these foreign materials can have what is called an adjuvant effect.
Right.
in people who are predisposed. So somebody with an SLE is kind of predisposed.
Right.
It's an unpredictable disease. So in these situations, maybe I will offer a fat grafting or something like that.
Okay.
So I'm talking about a very, very small minority. For the majority of people who have other conditions, as long as they are healthy, it's okay. If, for example, they are undergoing some active infection, obviously that is not the proper time to choose to do an implant.
Agree.
An implant must be done at a time when they are healthy.
Healthy person. Right.
It doesn't matter if they are diabetic, if the diabetes is well controlled. Doesn't matter if they are hypertensive, should be well controlled.
Well controlled.
That's
right. So Dr. Mohan, I've heard people getting confused between breast lift and breast implants. What exactly is the difference and how can people choose between two?
Okay, so breast implant is inserting the silicone implant.
Right.
And there are no other cuts. There is only a small cut under the breast,
Okay.
or sometimes through the nipple areola we can put in the implant, although I don't prefer that. But a breast lift is a proper operation to lift the breast, which is sagged. In a breast implant situation, the breast is not sagged. Because if the breast is sagged and we are going to put an implant as well, then
That
you
will
need
also
to
sag.
Yes, additional sagging will be there.
Right.
So we need to do a lift with implant. So there is breast implant alone. There is breast lifting alone. There is breast lifting with implant.
Again, on the skin texture, we were talking about the firmness of the skin and all, right?
So the point here is, if the nipple is looking down, that is called a sag. So if it is slightly looking down, when we place an implant and the skin and everything gets stretched out, there is a certain amount of lift that is provided by the implant itself, mild lift.
Right.
So the first degree of sagging, there are 4 degrees of sagging.
Right.
For the first degree of sagging, just the implant alone may correct that. Beyond that, we need to actually do a lifting. Now the lifting involves scars, either scars around the areola or around the areola and a vertical line, which is called a lollipop scar, or an additional scar or a line underneath.
Okay.
So breast lift is a good operation, but it involves scars on the breast. So we have to consider it carefully.
Okay.
And we can, if the breast is sagging and lacking in volume, then we need to place an implant plus do lifting.
Okay.
Yeah.
That's great. A good information.
I mean, there is with respect to breast, all options are available. You can increase, you can decrease, you can lift, you can reduce the size,
Right.
you can adjust asymmetries, plus you can correct odd or funny looking breasts. There are some girls that are born, and as their breast develops, it doesn't develop in a normal shape. It develops in a highly contracted shape,
Right.
distorted shape.
Right.
It's called a tuberous breast or a tubular breast. It's a special category.
Okay.
So there we need a breast implant also.
Okay.
And there we might end up doing a breast implant at a younger age, even at 16, 17 with the parental consent.
Right.
Otherwise, normally we do it after 18, after the age of majority.
Right. Great. You have implants with you, right?
Yes,
I'm
as I
excited to have a look at those implants and, to understand what are the shapes, what is the texture. So can we just have a quick look on the implants? I'm so excited. My goodness, a big bunch of breast implants here, huh?
Well, I brought one of each type
Yeah.
just to have a good variety and to illustrate.
Right.
So if you see, this is the first basic variety. This is the first kind of implant, smooth implant that was manufactured way back.
Right.
I'm not saying this was the implant of 1960s, but the old implants used to be smooth.
Okay.
And for a long time, smooth implants were the only ones available. Then in the second and third generation, they brought in textured implants. And
Right.
texture has a little bit of a Velcro-like effect. So it stays where you put in, and the capsule that forms around it is softer, let's say. So surgeons preferred the textured, while some surgeons still persisted with the round implant, with the smooth implant. But what happened? In the last 15 years or so, there is something called ALCL, which is a rare condition that has come to light, and that was associated with one particular brand of textured implant, which was very coarse texturing.
Okay.
Now that brand is discontinued. However, surgeons are more cautious now not to use coarse texturing, but still they want texturing. So the companies have come up with what is called micro texturing. So this
Okay.
is a micro texturing, all right? So is this. So
Right.
now we have micro texturing.
Right.
Implants, all right? And this is a big one, this is a small one. As you can see, when it goes bigger, the diameter is also increases.
Yes.
You see that?
Yes. Right.
Yes.
Right.
Now we talk about round versus anatomical. So you see, a round implant is equal in all directions. There is no top, there is no bottom.
Right.
Whereas this one is a anatomical or a teardrop shaped.
Teardrop, huh?
Shaped.
Ah.
So it's thicker in the lower part,
Right.
slimmer in the upper part. So
Looks
it
very
has
natural,
it
no?
has a direction. This is top, this is bottom.
Right.
So you have to insert it this way and not this way,
Right.
right?
Right.
So one of the small risks with this is once in the body, if it tilts for some reason, it will be kind of obvious. Whereas if a round implant moves around, no problem. There is no direction. So anyway, each has its plus and minus. So pros and cons. So we, the experts, help the patient to choose the best one. And this one, which is white in color, is actually the lightweight one, which is packed with a special gel, which is lightweight. Okay. And also its covering is a little bit different, as you can see. It's opaque white. So that I suppose gave you a
good idea about the various implants.
Peek view into the implants.
Actually, but again, my dear listeners, do talk to your doctor, ask the expert. We have given you complimentary evaluation. You can drop down comments as well. Every person has different requirements. Everything, from person to person it changes. So do take an advantage of the complimentary evaluation that you will be getting with Dr. Mohan Rangaswamy. Yes, thank you so much. So that was about the implants. I want to know, in breast cancer patients, Dr. Mohan, are they at bigger risk, or if they can easily go for an implant for the breast cancer patients? Or there is also one thing that breast implant people, if you get a breast implant done, you are more prone to get a breast cancer.
Absolutely no risk of increased breast cancer in people who have a breast implant in them. You can heave a sigh of relief. This has been asked multiple times. It's been investigated multiple times and proven beyond doubt that there is no increased risk of breast cancer with breast implantation. Now breast implants are of course used as much for augmentation as they are also used for reconstruction. So they have a big role to play in reconstruction, and I do use them. So they in fact, the breast implant story started with reconstruction actually. So they're still used for breast reconstruction following mastectomy for cancer.
Nice. And it does wonders, because I remember in our previous podcast we had a breast cancer survivor who underwent prophylactic mastectomy and
with
did a
reconstruction using breast implants.
Wonders. So second life of living the femininity. Yes,
absolutely.
Thank you.
Absolutely.
So these implants, Dr. Mohan, it's like females can go for breastfeeding after having implants as well?
Absolutely, there is no problem at all. This again has been proven many times that the silicone does not come into the breast milk. It's safe for the baby, and there are no interferences with the act of breastfeeding. Especially in breast implantation, because we are not touching anywhere the breast gland or the ducts when we are using the lower incisions. Sometimes if you use the incision near the areola, then there may be some interference in the ducts. Again, anecdotally, if somebody goes for very big implants, there may be stretching effect on the ducts. Maybe it can interfere with the lactation. But by far, there is no interference. There is no.
So again, this says that I'm telling my audience that you should not have unrealistic expectations with the size of the breast implants. Have a lot of other complications and side effects to it. So please talk to your doctor again before choosing your size.
For the optimum size.
Exactly. But then, so if a lady already has an implant, she can easily get,
she can get pregnant, right? She can do breastfeeding, everything she can participate in sports, she can do swimming, she can go diving, she can go up in the flight. Absolutely no problem whatsoever.
That's wonderful.
She can play sports. Everything is possible.
But I think during the pregnancy...
during pregnancy, of course, most elective surgeries are not done. So if the person is pregnant, obviously she has to wait until she is delivered and after the lactation is over. During lactation, again, we don't like to put in a breast implant. If there is a breast implant already, it does not interfere with lactation.
Right.
But when there is lactation ongoing, we don't like to operate on that breast and put in a breast implant.
Right.
We wait until she finishes.
Right. I know you're already a tycoon in this plastic surgery industry, Dr. Mohan. But I want to know, what is that something which makes you different from most of the other plastic surgeons when it comes to breast implants?
I would like to put it this way, that for giving the best result with the optimum safety, there are some rules. And if a surgeon follows those rules diligently, he or she will get good results.
Right.
So basically, it starts with, of course, the consultation and the sizing.
Right.
To choose the implant appropriate for that woman's body. In the conduct of surgery, we like to use the diathermy pencil with the least power that will work. That's something which I am very particular about.
Causing less damage to the skin.
Causing less damage, less heat damage to the tissues.
Right.
Doing a clean dissection without, messing around. that comes down to the surgical skill. Now, I say this because it has been shown that if there is a lot of devitalization, a lot of bleeding, a lot of blood suffusing into the tissues, bruising of the tissues by rough handling, etc., there are higher chances for seroma formation, there are higher chances for infection, capsular contracture, all these things are there. So clean dissection, not using a lot of cotton and stuffing inside, because we don't want to have any foreign body inside.
Right.
Then you inspect the cavity and you wash it, and the washout should come as clean saline. The washout must come as very clean return. We say it should come back like pink champagne. Okay. And then you put in the implant, and when you do not handle the implant, use some antibiotic on the implant. Now, a study has shown, in fact more than one study has shown, that when the implants leak, the manufacturers, when they study the implant that has leaked, they find that there has been some trauma to the implant by surgical instruments in the handling. Of course, the implant manufacturers may say that to absolve themselves.
Right.
I don't know where the truth lies, but nevertheless, it is true that the implants must not be overstressed. What I mean by that is, suppose the implant, in order to put it in, requires a 5 centimeter incision. Some people pride themselves and say, I can put in through 3 centimeter incision. I never put in through 3 centimeter, because you're really squeezing and traumatizing the implant in the act of putting it in. Right. And there could be latent damages that you can induce on the implant. So put in the implant with the least trauma to the implant. And a proper way of suturing so that it doesn't drop down. Right. These are some of the basic precautions. If you follow these basic precautions and have a clean surgical technique, usually it will reward you with good results.
Wonderful.
Yeah.
Wonderful.
So there's nothing very special about me.
No,
it's
the
just
precision.
that I follow all proper technique.
The precision, the tissue respect, I still remember that word.
And
that I
course,
haven't heard it from any surgeons yet. I'm sorry to say. Yes, of course.
Okay.
Tissue respect.
And of course, we look for that nerve and try and preserve that area. So these are some of the basic tips in the surgery.
Right. So Dr. Mohan, some patients, they come for a redo. Some patients are not satisfied with their procedures. What are the reasons of it?
It does happen. I think the overridingly most important reason is lack of understanding on the part of the patient during the initial consultation. Like I talked about,
or can be vice versa, not explained well?
Yes, also.
Right.
Yes, I was coming to that anyway. So that interaction between the patient and the doctor, and the patient to remember all those things in the choice of implant, that is one important reason for dissatisfaction, because somebody might choose a certain implant and after 1 year, 2 years, she thinks that, she should have gone for a bigger size. In fact, one survey was done in the US and women were asked after breast augmentation, do you think you would have preferred to go bigger than what you chose? And 80% of them said that they would have liked to go a little bit bigger. So that is, of course, American statistics. But I factor that in when I decide the sizing of the patient. Let's say, for example, 325 and 350 both will work for the patient. I might tend to choose 350 because of this background that women tend to go higher. Okay. Now, if the understanding was not good, then she might be dissatisfied and she might say, I want bigger.
Right.
Sometimes it is down to, again, re-educating her. The second thing is, if the breast tissue was not good, it was too lax, then it could sag early. Early sagging after breast augmentation is a possibility. The third cause, which I often see, is when the implant is put under the muscle. A lot of women insist and come to my clinic and say, I want under the muscle.
Right.
Because Dr. Google, somewhere they found.
Dr. Google, yes. Ask me about it.
That
yes.
under the implant is the best. But that's not really the best. So what happens when it is under the implant, the breast implant stays with the muscle, the overlying breast tissue sags, and we have a waterfall effect. We have a discordance between the maximum prominence of the implant and the maximum prominence of the breast itself.
So putting behind the muscles is never a good idea.
So putting behind the muscle is a good idea in highly selected cases, where there is no sag, where the tissues are firmer but very thin.
Right.
Very thin person.
Right.
The vast majority over the muscle is less painful also, and it's more physiological, I feel.
Right.
So that could be one cause for dissatisfaction.
So you have come across many redo cases, right?
There are cases that I have, and some of them have been my own. Since I have taken out time to explain to them.
Right.
Maybe they didn't understand it as well as I think they understood. Because human communication, sometimes you think they have understood. Sometimes I ask them to repeat whatever, we have discussed as a way of, cross-checking.
Right.
But whatever you do in any field, not just in plastic surgery, in any field, it's called the Chinese whispers, Have you heard of Chinese whispers?
No.
Like A tells B something, B tells C something.
Yes.
And finally, when it comes back to A, it's completely
something
different.
changed.
Although each person tried to tell exactly the same thing to the next person,
Yeah.
supposed to be in that game.
Yeah.
But something will get missed out, something will get added, something will get
Absolutely.
confused.
Right.
So it's a reality of human interactions.
Agree.
So that is one reason also there could be reason for redo. Then of course there are other things like certain small percentage have a leak. Then there's a redo requirement.
Right. Got it. So that was a great discussion about
Thank
breast
you.
implants.
Thank you.
It was again an honor and pleasure to have the discussion with you, Dr. Mohan.
Thank you so much.
My dear listeners, please, this podcast is not enough really to highlight all the bits and pieces of breast implants and breast augmentation. So please feel free again to connect with us and talk to us in whatever queries or concerns you have. We are there for you. Thank you once again. And thank you, Dr. Mohan, once again
Thank you, Dr. Anita.
Thank you.
Wonderful, always interacting with you.
Absolutely.
And
Thank
trying to educate the public.
Yes.
And trying to give my 2 bits of
Absolutely.
contribution.
It's a great thing we are doing
Thank you.
together.
Thank you.
We are on a mission, yes?
Thank you.
Long way to go.
Thank you. Bye-bye.
Thank you, Dr. Mohan.
Bye,
Thanks.
everybody.
Bye.
Bye-bye.